Hey there, everyone. This is Dr. Kevin Koska here. I am the co-founder and the co-owner of Summit Physical Therapy right here in Chattanooga, Tennessee. I appreciate everyone taking the time to learn about peripheral neuropathy. And while we have a couple more people hopping on to the call, I just want to let you guys know that we typically do these workshops in person at our clinics and demonstrate some of the techniques and some of the technology that we're able to utilize to help you. But since we are in the shelter in place right now, we are going to utilize this virtual workshop in order to be able to disseminate this type of information so that we can get help out to those people that need to be helped. So while a couple other people are still filing into the virtual workshop, I want to introduce our host today, Dr. John McGee. And I met Dr. McGee probably 3 or 4 years ago. And he is probably one of the smartest people that I know when it comes to peripheral neuropathy and actually treating this. He has educated me as well as our clinicians at Summit Physical Therapy in how to provide the best treatment possible for those that are experiencing peripheral neuropathy. So without further ado, I am going to turn it over to Dr. McGee and let him try to educate the rest of the Chattanooga community on what there is to do to be able to help those that are experiencing this peripheral neuropathy. So Dr. John McGee, I appreciate you coming on today, and
No problem.
I'll let you take it over from here, sir.
That's great. Dr. Koska, thank you so much for having me. It's a pleasure to be here and be presenting to the people of Chattanooga, Tennessee. So like Dr. Koska said, my name's John McGee. I'm a physical therapist. I'm originally from Ireland. I moved to Florida a few years ago. I used to specialize in back pain and sports injuries. And then my mother got diagnosed with diabetes type 2 10 years ago. 6 years post-diagnosis, she developed peripheral neuropathy in her feet. This was really debilitating for her. She had a lot of burning pain. She had lost the sensation in her feet, and she was really unsteady and afraid to actually leave her apartment. So I was amazed at how much it affected her and how limited the treatment options were available to her. The only thing really available to her was medications, and unfortunately the medications were making her worse because of the side effects. And she had multiple falls. 2 of the falls resulted in head injuries where she suffered 2 strokes. She broke her hip, and it really, really impacted her life massively. In a negative sense. She became depressed, and she was only 62 years old. So this started me on a crusade to try and find some treatment options for her, treatment options that didn't involve drugs, shots, or surgery, and treatment options that actually worked. So I did a lot of research, and I came up with a 3-step treatment program, which I use in my own private physical therapy practice in Florida. And I know Summit Physical Therapy uses it also, as does several other physical therapy practices I work with in the United States. So today, the goal is I want to try and increase everyone's knowledge and to let you guys know that it is possible to improve this condition, and in some cases completely eliminate your symptoms without the use of drugs, shots, or surgery. So there is hope, and after today, in about 40 minutes, you should be more knowledgeable on what your options are and how, in fact, physical therapists and Summit in particular can help you guys. So this photograph on the screen is actually my mother. That's when she came and visited me in Florida, and she's actually doing some treatment there as we speak. So without further ado, let's get underway. So today's topics, this is what we're going to learn. What is peripheral neuropathy? How it feels, the main types, the major causes, how it's diagnosed, the treatment approaches commonly used, and our treatment approach, and how we can perhaps help you. So first of all, the nervous system, it's broken into two components. You've got the central nervous system, which is the brain and the spinal cord. And then you've got the peripheral nervous system, which is everything else other than the brain and the spinal cord. So peripheral neuropathy, neuro is Greek for suffering or disease. Or sorry, neuro means nerve. Apathy means suffering or disease in Greek. Peripheral neuropathy is a condition that causes one or more of the peripheral nerves in the body, typically the legs and arms, to not work as they should. The peripheral nerves are responsible for sensations like pain, pressure, temperature sensation, as well as muscle function and movement. Peripheral neuropathy is on the rise hugely in America. More than 40 million people have been diagnosed with it, and 8% of the world's population has it. When I started this crusade about 4 years ago, that figure was 20 million. So it's actually doubled. Diabetes is the biggest cause in developed countries, 50%, which is incredible. Just like my mother, 50% of diabetics will get peripheral neuropathy. So it's a huge problem, and diabetes is the #1 cause. So in the United States alone, the healthcare costs are over $4 billion each year. So you guys probably know a lot more about how it feels than I do, because fortunately I've never suffered from it. But these are the common symptoms that our patients report, and also that we can find in the literature. So common symptoms are numbness, tingling in the hands and feet, inability to feel the ground because your sensation is reduced, which is a huge problem when you're trying to drive because you can't feel the pedals in your car, which is obviously a major safety concern. My mother's big problem was she couldn't feel her feet. So she was constantly falling and her balance was really bad. You get burning pain, sharp pain, throbbing pain. You also get weakness in the muscles of the legs and the arms. The reason that is because the nerves have two jobs. One is to supply power to the muscles, and the other is to supply sensation. So when you have a problem with the nerve, weakness and sensation usually results. Let's see. So the common types of peripheral neuropathy. Peripheral neuropathy affecting one nerve or a small group of nerves is called focal or mononeuropathy, and it often improves over time. Peripheral neuropathy affecting many nerves on both sides of the body is called polyneuropathy. And this affects both the muscle function and the sensation, and it usually only gets worse without expert treatment. So the common types that I'm sure you'll hear a lot about are small fiber neuropathy and also large fiber neuropathy. And it is possible to have both at the same time. Small fiber neuropathy, typically the patient would experience pain, a diminished feeling to temperature, heart rate and breathing might be a little off. And the important thing to note with small fiber neuropathy is a lot of the times it isn't picked up on nerve conduction studies. So this can be very confusing to patients. They come in, they're convinced they have neuropathy, they have the symptoms of neuropathy, but the nerve conduction studies were normal. So that doesn't mean you don't have neuropathy. It just means you could have small fiber and the signal was so weak that the nerve conduction didn't pick it up. Large fiber neuropathy is different, where it usually is picked up in the nerve conduction studies because the signal is stronger, because the nerve fibers are bigger, hence it's called large fiber. So the large fiber controls vibration, proprioception, which is like your internal GPS, your coordination, feeling where your foot is in space, and also you can get weakness with large fiber. A lot of large fiber people complain of pins and needles also. So like I said, it's possible to have both. So Peripheral neuropathy is a bad thing to have. As I say, it's on the increase. It's a major cause for wounds, amputations, and the most probably important one is it's responsible for more falls amongst seniors. Peripheral neuropathy patient who's over 60 is 20 times more likely to fall each year and 6 times more likely to fall repeatedly. So this was the huge issue that I had with my mother, because she was constantly falling, and it got so bad that she was just petrified to leave the house. And it was taking the fun out of her life, and she became depressed, as a lot of peripheral neuropathy patients do. So neuropathy is caused by many things. Like I already mentioned, 50% is through diabetes, but there are also other causes such as post-chemotherapy and side effects from drugs, particularly statins and antibiotics. Chronic infections can lead to peripheral neuropathy. And there's also idiopathic peripheral neuropathy, where 25% of the time we just don't know what caused it, but you do have it. So there's a lot of causes, and that's why it's important to get a good assessment, which we're going to discuss shortly, to find out what is causing your peripheral neuropathy. If you know the cause, there's an increased chance that we can help you with your symptoms. So regardless of the cause, there is inflammation and stress to the cells. So what happens is the blood cells don't transport oxygen as well as what they do when you don't have peripheral neuropathy. The circulation becomes compromised, the blood flow is compromised, the nerves don't receive the blood that they typically would, and that results in the nerves starting to die. And when they start to die, they don't function as they're supposed to. So a big component of our treatment program is improving circulation. We need to increase blood flow, which will help with healing of the nerve cells. So how is it diagnosed? I won't bore the life out of you with this, but there's a lot of tests have to be done to confirm you actually have peripheral neuropathy, and they're listed here. But what I would say is your clinician or your physical therapist should conduct a thorough examination to see if you do have peripheral neuropathy, and if you do, what problems are you having as a result of it? What are your deficits? A lot of people have balance problems, and pain is not such an issue. A lot of people have pain and balance isn't such an issue. A lot of people have no sensation in their feet and they don't have pain. So it's determining what your deficits are through the assessment that we would do, and the assessment that Summit also does. So like I mentioned earlier, the only real treatments I could find for my mother and in the research was medications. And unfortunately, the vast majority of people don't get favorable results with the medications. The medications have a lot of side effects, and one of them is dizziness, which, as you can imagine, is not a good thing when you're already having balance problems. There are multiple side effects that is listed in the next slide, I believe, so we'll go over those. But these 3 drugs are the most common drugs, and I'm sure a lot of you recognize these drugs. Unfortunately, again, the drugs, they don't address the underlying cause. They only mask pain, and a lot of the time they aren't successful in doing that. They don't improve sensation problems, and they also have, like I say, a lot of unpleasant side effects, interactions with other drugs, and they can also be addictive. So here are the side effects. I'm not going to go through them all, but this is just some of the more common ones. Number 3 there, dizziness is a huge problem, especially if you're already struggling with balance. But the other ones are also pretty bad also. So we wanted to devise a treatment protocol that didn't include drugs, shots, or surgery. so as you didn't have these unpleasant side effects. So our approach and Summit's approach is we focus on your needs and your health goals. Our program is drug-free and it does address the underlying cause. Our goal is to improve your functional limitations that are lost to peripheral neuropathy. That's why we do a comprehensive assessment, because we want to know what you can't do as a result of you having peripheral neuropathy. What could you do before that you can't do now? And the treatment program that we've devised is evidence-based and it's backed up by science. When I was studying in physical therapy school, our school was very, very strict on making sure the treatments we did were evidence-based treatments. And what that means is the treatments that we did had to be backed up by science. Okay, so that's why it took me several years to develop this program, because I wanted to review all the research that was currently available, and I did, and I've came up with a great alternative for peripheral neuropathy patients. So the assessment that you would go through, like I said, it's comprehensive, but it is very, very important, because some people don't actually have peripheral neuropathy. They have radiculopathy, which is nerve pain, but it comes from your spine, from your low back usually, or if you have neuropathy in your hands, from your neck. So it's important to rule out neuropathy or rule it in. Okay, I would say 10% of the people that come to our practice actually have radiculopathy versus neuropathy. And radiculopathy is a lot more easier to treat. And also we would like to assess you to see if we can actually help you. And if we can help you, we'll let you know that. If we can't, then we'll refer you to someone else. Okay, so not everybody is suitable for what we do. Sometimes we need to get other people involved, other physicians. So again, I won't bore you with how we assess you, but we basically check 5 systems. And they are on the screen right now. They are your integumentary system, which is your skin, hair, and nails, the nervous system, the musculoskeletal system, which is your muscles and bones, your circulation, your vascular system, and also your balance system. A lot of people, unfortunately, get very weak when they have peripheral neuropathy because, like I said before, the nerves also supply the power to the muscles. So if you have neuropathy in your feet, the muscles in your feet are probably going to be weak, and also maybe your calf muscles and your quadriceps, etc., etc. So we do a full examination just to make sure exactly what your problems are. So now for the good part. So we devised a 3-step treatment protocol. Okay, step 1 is physical therapy exercises. Okay, and in order for us to devise your exercise program, we need to do an assessment, like I say, so we can determine your deficits, and then we build a therapy program specifically for you. So as part of the physical therapy exercises, we will do a lot of strengthening and stretching of the muscles that have been affected. We will do a lot of balance work to improve your balance. If balance is a huge issue for you, we will do a lot of balance work. And then thirdly, we will do nerve glides. Nerve glides are very, very important, where we actually stretch out your nerves very gently in a very specific way, because research has shown that people with diabetic neuropathy, their nerves don't glide as well as people that don't have neuropathy. When I say glide, I mean move. Your nerves have to move a little bit whilst you perform movements in the body. So we'll spend a lot of time on nerve glides, balance work, and strengthening exercises to help you function better. So that's step 1. Step 2 is our secret sauce. It's the Anodyne light therapy system, and the patient does this at home. Okay, they use this machine. I'll show you it here. They use this machine, they purchase it from the practice, and they use it 30 minutes every day at home for 90 days. Okay, so The research shows you get the best results using this for 90 days, 30 minutes every day. So you will do the physical therapy 2 to 3 times a week for 4 weeks, okay, in the clinic with Summit Physical Therapy, and then you will use the Anodyne light therapy at home. And the reason this works so well is because in the past, patients used to have to come to the physical therapy office to get the Anodyne light therapy. Now, it used to be very expensive and patients could only maybe come twice a week or maybe 15, 20 minutes. So unfortunately, most of the time that's not enough light therapy. But now Anodyne has devised a mobile unit where the patient actually purchases the unit and brings it home so they can use it every single day for 30 minutes. And doing that, the studies have shown it relieves pain, improves sensation, and also helps with better balance and reduces fall risk. So when I was doing my research, I was trying to find something like this. And when I came across the Anodyne, I was blew away by how much research there actually was to support its use. There was 14 clinical studies involving over 4,000 patients, which is a hell of a lot of research. All right. So what it does, basically, it increases blood flow. It increases circulation to your feet and your lower extremities. And as we've already touched on, improving blood flow is key to restoring the health of your nerves because the blood carries oxygen and nutrients to the nerve cells. Okay? So this slide here is the bottom of a patient's feet. This patient had peripheral neuropathy, and as you can see, it's just blue. Blue denotes no blood flow. And then 40 minutes after Anodyne, you can see the blood flow. So the red is the blood flow. So there's a huge difference between pre-Anodyne, 40 minutes after Anodyne, pre-Anodyne, 40 minutes after. Okay? So this was key for me in selecting the use of Anodyne. I could have picked any device I wanted, but this one had the most research, and this was a scientific study done with an ultrasound laser scanner where they could see the blood flow. So 3 hours after Anodyne, you can see there's still more circulation, but they're starting to lose blood flow a bit, and that's why it's important that Anodyne devised a home unit so you can use it every single day as opposed to twice, 3 times coming at the clinic. That's why we're getting better results now than we did 10 years ago. So why use it? Like I've already discussed, 14 clinical studies, over 4,000 patients. So if you have food sensation problems, right? And this isn't my words. This is from the studies, okay? And we can send you the studies, anyone that wants to read the studies. So if you have food sensation problems, using this protocol, 97% of patients can expect improved food sensation. Okay, that's huge. That's fantastic. That's based over 4,000 people. So a huge sample size, okay? And the average improvement was 65%. If your big issue is pain, 92% of patients can expect some pain relief. The average pain reduction was 60%, which is really, really good. It's also important to understand about peripheral neuropathy. If you have really bad peripheral neuropathy, the chances of you being symptom-free are slim. You know, it all depends on the severity of your neuropathy. It's a difficult condition to treat. It's a progressive degenerative condition. So not everyone is going to get complete symptom resolution. But what this can do for even the most severe patients, this program, is it can get you off the medication. It can get you using light therapy, physical therapy exercises to manage your symptoms as opposed to taking medications that have a lot of the time bad side effects. Okay? Now, the people that don't have their neuropathy is not so severe, you could get complete symptom resolution, but you will certainly get help based on these studies. You will certainly see an improvement. And then in the case of my mom, the better balance and fall risk, 90% of patients can expect better balance, reduced fall risk, and fewer falls. So this is huge, especially for our seniors, because there is research out there that shows people over the age of 60, when they have a fall, it can be quite traumatic due to the secondary complications, such as, as being immobile. Your heart and your lungs and your circulation and your bone density decreases rapidly because you're off your feet. So it's important to stop our seniors from falling as much as we can and try and help them. And step 3, okay, so this is the final step of the program. Step 1 was physical therapy exercises in the clinic with your physical therapist 2 to 3 times a week for 4 weeks. Step 2 was the anodyne, 30 minutes a day for 90 days. You keep the anodyne unit, it's yours forever. Step 3, probably the most important one. If you really, really want to make a huge difference to your situation, you need to do all 3 steps. Step 1 and step 2 are fantastic. They will help most people. But if you can do step 3, where you change your diet and your lifestyle, you are going to see the most improvement, and it'll be a long-term improvement. So I know Summit, and we do as well, we have all the latest guidance from the Foundation of Peripheral Neuropathy, and they have a whole list of foods that you should and should not eat if you suffer from peripheral neuropathy. They tell you the vitamins that are important for peripheral neuropathy, and they also have a whole bunch of guidelines to help you manage this condition. But the diet and lifestyle is huge. There's some foods that are just horrendous for neuropathy, and there's some foods that are really, really good that helps reduce inflammation. Okay, so you should avoid factors also like repetitive motions, cramped positions, exposure to chemicals, smoking, overindulging in alcohol, and you should exercise regularly also. But we'll give you all this in a handout. I know someone has it, I also have it. And if you can combine step 3 with step 1 and 2, I would be very confident that you will do well. So, if anyone has any questions, I'm sure Kevin or myself can answer any questions you have.
Yes, sir. Well, Dr. McGee, I really appreciate all of that information regarding how to treat peripheral neuropathy, the 3 steps there in regards to physical therapy, the light therapy with the anodyne, and also adjusting your lifestyle. I think those are all very important topics, and as well as thank you for sharing your story on your mother and how you came about finding this technology and developing this peripheral neuropathy program, and how it's affected your life, your mother's life, and how it has improved your mother's life as well. So I appreciate the time that you have taken, and if you would like to comment below for everybody on this webinar, this virtual live webinar, if you could comment below if this is something that you have a question about or that you would like to ask me or Dr. McGee about, please comment below. And if you would like to actually make a visit into the clinic or set up a virtual session, then please comment below and we can throw the link in there and get you guys signed up for a free virtual session or a free screen, or if you want to go ahead and get started, we can go ahead and check with your insurance and try to get you started there. But really the main purpose of this was just to give some general information about what peripheral neuropathy is, as well as how it can be treated. So we don't want to take too much more of your time, but again, if you got questions, throw them in the comment section below. If there's anything else that we can do, you can always reach us at Summit, SUMMIT -therapy.com, or you can call us. If you have any other questions, you feel free to call us as well, 423-777-4974. Dr. McGee, thank you once again. Is any closing remarks or anything else that you feel like you left off before we leave?
Yeah, I would just encourage people to, like I say, when we do these workshops live and in person, If you have peripheral neuropathy, you should avail of the free screen that I know Summit offers and also that we offer. Because, I mean, what have you got to lose? You can come in, get assessed by a doctor of physical therapy. They can tell you what your options are, and hopefully you're suitable to do this, and you can start getting relief, as have thousands of people that have gone through this program. It certainly changed my mother's life. That's why I'm doing this. Like I said, I was a back pain and sports injuries guy, but when I seen how much these people suffer and how limited the treatment options were, I thought I need to try and do something. So I would definitely encourage people to take the bull by the horns and get started and try and get some help.
Yes, sir. Yes, sir. Thank you, Dr. McGee. And once again, if
Not
you
a
guys,
problem.
oh, sorry.
No, I said no problem. Thank you so
Oh,
much.
yeah, you're very welcome. All right, guys. Again, drop your name in the comments below. Drop any questions you may have in the comments below, and we will be glad to answer those for you. So once again, stay well and have a great day.